It compares the symptoms and what you would see when you have morning sickness and the difference you would see when you have hyperemesis gravidarum. So I will just share the official definition that came out in 2021 called the Windsor definition. And it's an international definition. Really cool that it came out not too long ago. And it kind of summarizes what Maria had mentioned. If you think you have hyperemesis, this is what you're going to see. So I'll just read it out here. HG is a condition that starts early in pregnancy before 16 weeks and is characterized by severe nausea and or vomiting, inability to eat and or drink normally, and strongly limits daily activity. And as you mentioned, Alexa, you were in bed so much. And I think that's so common for those suffering from hyperemesis gravidarum. It's such an extreme condition.
Welcome back to another episode of Beyond the Birth Story podcast. If you are joining for the first time today, I'm your host, Alexa C., girl mom, angel mama to one of the sweetest boys in heaven, birth trauma and uterine rupture survivor, and former NICU mama. Here you will have the opportunity to ask and have your burning questions answered by professionals, feel connected to other women's experiences as we normalize the different aspects of this journey we are on as moms. The real and raw moments of healing are shared here as we navigate loss, embrace strength, and find hope again while learning to live after loss. Please note the topics discussed on this podcast are for educational purposes only. Please see your personalized medical professional if you have any questions or concerns that arise from listening, including diagnosis and treatment. Okay, well, first and foremost, my name is Alexa, and I think I've been chatting with Julia for kind of the most part, it seems like. But nonetheless, I'm so excited to finally have both of you here to chat with me. I have a personal experience with HG with my daughter, and I was quite a bit younger at the time and remember just it was so isolating. I knew nobody else who was ever as sick as I was. There was not a lot of interventions for me. I spent most days sleeping about 20 to 24 hours a day, basically. And when I would wake up, I would be vomiting. And so I seen the inside of emerges quite often, but sometimes they would be like, well, pregnancy sickness is normal. Here, try a popsicle. We'll see, because we don't want to give you an IV again. And of course, that would not sit, and I would have fluids and IVs and Gravol and you name it. And still to this day, I know a couple other girls, but personally, I don't come across it very often. And so I'm excited to kind of hear your girls' stories and relate to someone who's been through it and hear about all of the work you have been doing. You girls obviously know best, and I want to use you for all of your knowledge here today and really shine a bright light on what HG is and how we can spread awareness and hopefully, help other women if they find themselves going through the same thing, unfortunately. So whoever wants to go first, I'll give you the floor. You can introduce yourself, give a little bit of a background, and we'll kind of just go from there.
Sure. Hi, Alexa. Thank you so much for having Maria and I on your podcast today. We're so excited to be here and to talk to you about hyperemesis gravidarum. And as you said, shed a little bit more light on what hyperemesis gravidarum is. And my name is Julia, and I have two young boys, two beautiful boys. And during my pregnancies, I had hyperemesis gravidarum both times. During my first pregnancy, I didn't know that I had it. And then during my second pregnancy, I was a bit more educated on it, and I did know that I had it the second time around. But after both of my pregnancies, I became a passionate advocate for those going through hyperemesis gravidarum and their families. And that's kind of how Maria and I met. And maybe we can touch a little bit more on that after. But yes, I am in Ontario, and I have a wonderful husband who supported me through both of my pregnancies. And I can't wait to chat a little bit more about HG with both of you.
Thank you for that. Maria, floor's yours.
Well, I think that people that is listening may be wondering what it is hyperemesis gravidarum. And hyperemesis gravidarum is what the three of us had during our pregnancies, and is a life-threatening condition that is very debilitating, and is different than morning sickness. This is extreme vomiting, extreme dehydration that can lead to malnutrition, and is actually a risk also for the baby. So I was so scared, and I didn't know that I had it during my first pregnancy for the first trimester. Then I got diagnosed and very, very sick, receiving home care treatment. I am based in Alberta, and here in Calgary, we have an awesome program, and I got a referral to it after self advocating a lot. During my second pregnancy, I knew that it was coming, so I was more prepared, but I was also more sick.
Mm-hmm.
So, yeah, I am a survivor as well and have two beautiful kids with me here on earth. And during the process, I lost three other kids. So they
Sorry
are
to hear
in
that.
my heart. Um, but the journey was very tough.
I can completely agree and relate to that tough journey, unfortunately. So I'm sorry you also had to endure that heartbreak, and I'm so thankful that you do have your two little ones here with you and that you're able to love the three in your heart so much every day. So, what exactly are you guys like? Did you want to start with maybe your personal experiences? Julie, do you want to extend maybe a little bit more on yours?
Sure, yes. So, for those listening, I think it is so important to really know the difference between morning sickness, or I prefer to say pregnancy sickness,
Yes.
and the difference between pregnancy sickness and hyperemesis gravidarum. And for those of you listening, if you're wondering and you're curious, the Her Foundation, which is HER, is based in the US, but they support internationally. They have some wonderful resources on their website. And one of the resources they do have is a comparison chart. So it compares the symptoms and what you would see when you have morning sickness and the difference you would see when you have hyperemesis gravidarum. So I will just share the official definition that came out in 2021 called the Windsor definition. And it's an international definition. Really cool that it came out not too long ago. And it kind of summarizes what Maria had mentioned. If you think you have hyperemesis, this is what you're going to see. So I'll just read it out here. HG is a condition that starts early in pregnancy before 16 weeks and is characterized by severe nausea and or vomiting, inability to eat and or drink normally, and strongly limits daily activity. And as you mentioned, Alexa, you were in bed so much. And I think
Mm-hmm.
that's so common for those suffering from hyperemesis gravidarum. It's such an extreme condition. And personally, when I went through it with both of my pregnancies, I experienced a few other things which I understand is also common to hyperemesis gravidarum. One was something called tylism, which is basically excess saliva, which is kind of like that feeling that you're going to vomit.
Mm-hmm.
Like right before you're going to vomit, you get this feeling. And it was kind of like this constant, I know it sounds gross, like excess saliva that just doesn't go away. And one of the other really big things for me, and what made the time with HG so debilitating, was the hypersensitivities that I had during my pregnancies. And so those included a hypersensitivity to light, sound, smell, taste, and motion. So it could be something like a dog barking loudly, and I would hear it from my bedroom, and it would make me vomit. It was so extreme. And there were days I couldn't look at screens like my phone or the TV, because the second I saw the light from the screen, instantly it would make me sick. So what I didn't understand during my first pregnancy was that what I was going through was not normal. And I
Mm-hmm.
think that's the case many times. It gets dismissed as morning sickness when really it can be very dangerous. As Maria mentioned, it can be very dangerous for the mother's health. It can be very dangerous for the baby. And for me, it was um, a lot of very violent, intense vomiting, which can be the case for many. I do know that there is also a version of HT where women experience the extreme nausea all the time, but not necessarily the vomiting. Unfortunately, I kind of had it all.
Mm-hmm.
But I was one of the lucky ones where I didn't have the worst of the hyperemesis gravidarum symptoms the entire pregnancy. So they did subside around with my first a little bit earlier, in the second trimester, later in the second trimester. And with my second, it was towards third trimester, where a lot of those really debilitating symptoms started to subside, and I was able to function more normally as a pregnant woman. But during my pregnancy, with my second son, I did need to take time off of work. There were days I spent, as you mentioned, just hours and hours in bed where I could do nothing but just lay there. And it really takes a toll on your body. And it makes you question, after your pregnancies, what toll has this taken on me, and will it negatively affect me, into the future, my health into the future as well. I think that's just such a big question that kind of lingers with me as time goes on. But during my first pregnancy, it was the start of the pandemic. So 2020, the world had just kind of started to shut down, and my husband and I were overjoyed to find out that we were expecting our first son. So as the world kind of shut down, so did I
No
during my pregnancy.
kidding.
Um, we weren't required to go out and do anything because everything was shut down. So I didn't have to get in the car and drive everywhere. So it did mean I could be at home and run to the bathroom whenever I needed to, or lay in bed as long as I needed to. And because I didn't have another child at the time, my husband was basically my nurse. He was able to care for me. He brought me everything he thought that maybe I might be able to keep down. With my second, things were much different. I spent uh, much of one summer basically in bed while my husband cared for my firstborn. And it did improve by the third trimester. But I think the difficult thing with hyperemesis gravidarum is it's hard for people to see what really goes on because we are basically stuck behind closed doors when we're so sick and so ill. And during those times when I was at my worst, I was completely happy having kind of like the door shut, because I didn't want people to see me so sick. I
Mm-hmm.
didn't want people to see me suffering. And I also felt that there was a lot of misunderstanding with it because it's just brushed off as morning sickness. And, how could you be so sick? How could you not be coping when it's quote unquote just morning sickness? So that's kind of a quick summary of how things went.
Yes. Thank you for sharing that. I feel too, myself as a first time mom, like everybody talks about, being sick in pregnancy and how it's normal. And when you continually are sick and people, yeah, just don't understand, they're like, okay, yeah, you're still throwing up. But it's such a violent thing and you cannot function. I remember being so scared that my daughter wasn't getting enough nutrients because I
Yeah.
couldn't take anything in, but she's still taking everything from me. And then I'm left to have nothing, no nourishment, no anything. And just that, yeah, dismissive. And I was sick. They were still pushing gravel when they did my C-section with her. It was right up until 40 days or 40 weeks that I was sick. And then with my second pregnancy, I think it was around that 17-week mark that it ended up subsiding. But those first weeks, I felt like the worst mom in the world because I could not give my daughter any care. I could bear, like, she was just watching her mom basically cuddling the toilet at that point. Like, that's all I was doing. And then with my third, thankfully, I didn't have any in the beginning, but it was crazy. I just remember being able to go to work and not have to always call in sick. And my dad would check in on me, and I'm like, I have a quality of life this time that I didn't even realize I was missing when I was in the thick of my sickness with my pregnancies. And after my first, that's what I thought was normal. And then when I got into my second, had different care, someone who was willing to be like, no, there are these medications available to you, and let's start taking them right away. And then I really implemented that with my third, and it helped, but nothing, no medication, no anything in my first pregnancy would even graze the sickness or the nausea that I was having. It was, thinking back to it, I'm like, I don't know how I did it. And I also don't know how I decided to do it not only again, but 2 more times with the risk. And for myself personally, I feel like it got a little bit better each time. But then, Maria, you said it got worse for you.
Yeah, it was worse. I think that in my first pregnancy, as you said, I was thinking, okay, this is normal. This is just
Yeah.
pregnancy. But then I have a very good friend that is a doctor. And I was just telling her, I'm really not feeling good. And she said, okay, let's try and check your weight. And then we realized that I have lost 20 kilos. And that's a lot. So
That's a
she said,
lot.
no, you need to keep going to emergency. By that point, I was going to emergency each 2 days just to receive antiemetics and hydration, but it wasn't enough. So I remember that I was in tears, and she just told me, you need to go. You need to tell them that you have hyperemesis gravidarum, and you need to start advocating for you. And I think that the support of my husband was so important at that moment, because I was not feeling good enough even to fight for me. So he was the one who started advocating and asking for better treatment for me until I got a referral for home care. And then after that, I was hospitalized multiple times for multiple days. But then we were alone. I didn't have another kid to take care of. So I think that that was a little bit better than the second time. During the second time, um, I realized that I was pregnant in an unexpected way, because I started throwing up, and I started throwing up blood. So it was that violent that I had a gastric bleeding. So I went to the emergency, and they asked me if that have happened before. And I told them, yes, actually, during my pregnancy, I had hyperemesis gravidarum. So they said, okay, we will need to do some exams. And after an hour, the nurse came back and told me, well, hyperemesis is back. You are pregnant.
Oh my goodness.
Um, it was so scary. I was excited because of the baby,
Yeah.
but then I knew that hyperemesis was back.
Mhm.
And it was very tough being apart from my daughter, because I got hospitalized in a COVID unit. So I was isolated from her and from my husband for 3 weeks. It was very difficult for me, very difficult for them.
Mhm.
Actually, my husband took a caregiver leave because I was literally unable to do anything by myself, not even taking a shower. After I got discharged, I got admitted into the home care program again. Um, and then they were visiting me daily, on a daily basis. The treatment was very long, so I had daily IVs for 4 hours. And then overnight, I had a subcutaneous line, and my husband um, just push some extra meds there, because I wasn't able to take anything oral or anything, even antiemetics that are rectal didn't work for me.
Wow.
So that was the only option that I had. The nausea and the vomiting never disappeared for me. I think that I got better when I delivered.
Mhm.
After the placenta was out, I was okay again, both times. But then my treatment was meant to keep me safe and to keep my baby safe, not actually to reduce nausea and vomiting, because that never happened. And I
Mhm.
think that that was the difference between the first and the second pregnancy, and is that Even when I was worse in the second pregnancy, I was not expecting to get better. But the level of frustration during my first pregnancy was very high because everyone told me and keep telling me, you are going to get better after the first trimester, then you are going to get better after 20 weeks, then after 26 weeks, and I was not getting better. And it was a doctor in the emergency room that told me, you know what, by this point of the pregnancy, we have tried all the medications available, we have used the algorithm, and there's nothing that we can offer to you. You need to realize that you will be like this until you deliver. And it was very tough, but at the same time, it was a relief
Mm-hmm.
because then I was not frustrated anymore. When I reached another week and I wasn't getting better, I knew that it was going to be until the end.
Mm-hmm. I remember thinking that too when, as soon as my placenta was delivered, I was like my old self again. I was like, I am not nauseous. I am not vomiting. I can look at food and want to eat it. I'm like, this is crazy. It was literally a switch, like night and day different. I couldn't believe it. Um, I'm glad that you guys say the okay. So it's hyperemesis grave. How do you say that?
Gravidarum.
Gravidarum. Okay. I have been spending pretty much forever trying to figure out the pronunciation, and I think I already forgot it, so I'm just going to call it HG.
I think that's such a
Yeah.
one of the difficult things with
Yeah,
H2 is that it's just so hard to say.
it
You know,
is. So
it's
either, yeah,
complicated to write, and it just makes things so much more
yeah.
confusing on top of everything else.
I'm like either HG or just hyperemesis. And people seem to know what you mean when you say that. Maria, that program, sorry, that you guys have in Calgary, is that a specific HG program, or is that just a home care nurse coming into your home providing you these medications and things like that?
Well, it's not designed for hyperemesis, but I know that they admit patients with different conditions that
Mm-hmm.
require continuous medication.
Okay.
Um, but it's basically designed to keep people out of the hospital
Mm-hmm.
when they need treatment, but are not that bad enough to be in a hospital, in a clinical setting, or are really not in a good condition, but then home is a better setting to get better
Yeah,
anyway.
I was just gonna say
So,
that.
yeah, so that is the mindset of the program.
Mm-hmm.
I think that that's why they offered me the program during the second pregnancy because they realized that we can keep this person for 9 months in the hospital. She have a toddler. She needs to be at home, but she needs all the same um, kind of medications that we would provide in the hospital.
Mm-hmm.
So it's actually a very nice program. Paramedics, community paramedics are the ones who come to the patient's home and provide all the treatment there. That is the community paramedics program. And then the program that I got admitted during my second pregnancy is called the Complex Care Hub, and then you have an internist that is managing everything, and paramedics are the ones coming.
Interesting. Okay. I again, I don't know anybody in my local area or my little town that's had it, so I'm going to have to even look to see if we have anything like that here. But I was in Lloydminster, which is about 35 minutes away from where I am now when I was pregnant with my daughter. And yeah, I just kept going into emerge and emerge and emerge. I'm like, and they never once offered me any other kind of intervention or, that home care setting where you're right. When you're that sick, you don't want to be in a hospital bed. You want to be cozied up in your own environment, and especially, during COVID times, if your family wasn't able to be there. I mean, not only are you that sick, but then your mental health is going to go in the toilet too, above and beyond just being sick with not having your loved ones. And I feel like especially your children right there with you, right?
I think that what you are saying is so important, and that is the other piece. Mental health
Yeah.
is an issue because it's a very isolating condition, and
Mm-hmm.
when you feel that nobody is understanding, everyone is dismissing you because it's just morning sickness, and you are there, unable to do anything else,
Mm-hmm.
and even unable to or willing to talk to anyone because you don't want to. You
Yeah.
are not in that mental state to even connect with others. So
Mm-hmm.
it's very difficult, not only for the person, but for the family as well. We needed counseling, not only during the pregnancy for me and for my husband and my daughter, but after the pregnancy. Actually, we are still working on the trauma that AG left for us because it's not easy. My
Mm-hmm.
daughter was so resilient. She was 2 years old at that time, and she was a baby. Now that my youngest is 2 years old, I I am starting to realize how little she was when I was pregnant. And she was so strong, but as soon as I delivered, um, she finally got her mama back. And at the same time, she was able to bend and starting expressing her emotions that
Mm-hmm.
were just encapsulated in survival mode while I was pregnant.
And we become such shells of ourselves during those times, right? And they're our little humans are used to seeing, this, go get her mom and like being able to do whatever they want us to do and things like that. And I don't even enjoy listening to someone vomiting beside me in any type of setting. And so for them to just see mom doing that literally 24/7, like there's no breaks. It's resilience is such a word I use often for my eldest girl. She's been through it all with me outside of that pregnancy. And a joke we have is when I was first pregnant with my second, she was like, "Can you put me back in your tummy?" I'm like, heck no. Like, you and I did not vibe during that pregnancy. I'm like, I much prefer you out here. She's like, I just want to be cozied in again. I'm like, yeah, no, I never want to be that sick ever again. Um, so you said that the Her Foundation is based out of the States. How did you guys kind of adapt and incorporate that into like for us Canadian girlies?
Yeah, so I actually didn't discover the Her Foundation until after both of my pregnancies. Unfortunately, I during my pregnancies, as you both have mentioned, it's so debilitating, and the state that you're in doesn't allow you to be researching. It doesn't allow you to be reaching out to people. It doesn't allow you to be to know really what you need because you're in such a bad state that you're really just trying to get by. And I remember there being days that I wouldn't even try to just get through the day. It was like I was living minute by minute, trying to survive and just focusing on making it through. And I think it's just so important what you touched on as well about it being an all day illness, an all day relentless nausea that never ends. I would go to sleep at night, and then in the middle of the night, I would get so nauseous, I would be woken up from it, and then I would be crawling to the bathroom where I'd usually spend the rest of my night, and then back and forth. During my second pregnancy, not even walking to the bathroom, I was just so weak, and it really takes so much out of you being sick so often. I think when you have hyperemesis gravidarum and you're vomiting so many times, I mean, we're not talking about like once a day here and there. It can be, depending on the severity of the HG, hundreds and hundreds of times over the span of the pregnancy. I mean, hundreds and hundreds of times, right? And this kind of violent and forceful vomiting, it's so hard on the body, and it's hard on the mind, and then you can't really advocate for yourself. So during my pregnancies, especially with my second son, there were times that I tried to kind of research things and look things up and figure things out. I found that our healthcare system, it's there are protocols, and our healthcare professionals have information. It depends on, who you're seeing, kind of to know really, the care can be vastly different from professional to professional. And I think very little is still known about HG, unfortunately, for many professionals. They just maybe haven't come across it. It's not really on the radar. And so when I was really searching for support, or like people, there must be someone, I was thinking there must be somebody else out there who's feeling this badly, who's having these symptoms, when I had those hypersensitivities, and basically any kind of smell would just immediately make me vomit, no matter what it was, even if it was something pleasant, beautiful, perfumes or soaps or anything like that. It just seems so strange to be saying out loud, like, this made me sick. A dog barking made me sick. I smelled smoke and then I got sick. I think because of all of these strange symptoms, I started looking into it more and more. And after my pregnancies, when I really had the capacity and the mindset to do that, I found the Her Foundation finally. I think it was one of the biggest aha moments of my life, just being able to read other stories that mirrored mine and sounded exactly what I had gone through. And I also became very frustrated in those moments because I realized this is what I had gone through, but I had no knowledge of, the knowledge and the education, and I didn't have the capacity to advocate for myself because I didn't even know what I would be asking for. And I think the amazing thing with the Her Foundation is they have so much information. They have protocol that you can bring to your medical practitioners, and they have support pages that you can share with family and friends, how they can best support you. They have virtual support networks. It's just really an amazing foundation that supports internationally. And I think it's just such a wonderful resource to have and to be able to be connected with, if you have Hyperemesis gravidarum or if you know of someone who has it. So it was Kimber McGibbon, Anne Marie King, and Jeremy King who founded the Her Foundation originally. And then Dr. Marlena Fejo, who does the research aspect for the Hyperemesis Gravidarum Foundation. And she's definitely one to follow if you're looking to know a little bit more. But to basically, after having that huge aha moment and exploring everything on the Her Foundation, I decided to try and see if I could reach out and find Canadians around that have gone through Hyperemesis gravidarum. So in February 2024, 1 year ago, I created the Hyperemesis Gravidarum Canada community chat Facebook group. And little by little, women started joining who had gone through HG in Canada specifically. And that's where Maria and I connected. She joined the group when I was looking for someone to facilitate it alongside me as it started to grow. And Maria offered to join me and facilitate it with me as well. We connected, and we're both very passionate advocates about Hyperemesis gravidarum. And so I've just had a really great time connecting with Maria, and we've been working on a few things together. One of them is the Instagram page, hg.canada, where we share information about HG. And we also created a LinkedIn page for professionals called the Professional Network for Hyperemesis Gravidarum in Canada. So we're trying to get things going and make some connections. And that's basically where Maria and I met on Facebook through the group chat.
I love
Yeah,
that.
it was an amazing connection. I think that it was meant to happen. I work as a patient advocate. That is part of what I do. And I work on maternal health. And I started looking for people that were interested in Hyperemesis gravidarum. And it's surprising, but because it's not that common, there is not that much interest in the topic. So it was very timely, because when I saw Julia's post asking for Canadians that had Hyperemesis Gravidarum, it was like a special moment for me, because I finally connected with someone with the same interest. And I think that Julia is doing an amazing job leading all this initiative. I am behind the scenes providing some support, providing some background on how the advocacy world works. But it's actually Julia, the one posting, designing all the content. So I think that we are such a good team, and it's really amazing to have a place for other moms to connect with us and provide the support that we didn't have. Because sometimes you not only need doctor that believes what you are going through, sometimes it's not just the healthcare providers level what you are looking for. Sometimes you just need someone to relate with, someone that really understands. And I think that that is what we are doing and what we are most interested in, because people is really resonating with our stories, and then they feel that is a safe space to share what they are going through.
And I think that's so important, right? That community aspect. And that's kind of where all this stems from, too, is you need that relatability and things like that, right? And you need to hear that you're not alone and that other people made it through this. And it's extremely hard when you're going through it, but there is an end point. There is a goal you're going to get to, and you are going to feel better one day. But those 9 months, if you make it the 9 months, and I say that because I'm a preemie mom, it's, some people, they talk about how fast their pregnancies and that go, like, mine felt like it lasted 10 years. Like, I was just like, when are we going to be done? And I was, like, my now husband, we weren't together when I was pregnant with her. And so when I was living in Edmonton, Alberta, which is good 2.5 hours from where we are. And so there was logistics involved, and I was alone quite often. I was in nursing school. And so I remember, again, I didn't really understand the level of sickness I was going through and things like that. And I went in to write one of my nursing exams, and I was newly pregnant. I found out also, like you, Maria, I thought I had the flu. Joke's on me. I had a 9-month flu. But that's how I found out. And from there on, it never left. And I was writing a nursing exam, and I told my instructor, I said, super early, but I am pregnant and I may need to leave the room. I am unwell. And she put a garbage beside my desk. And that is where I vomited for my entire exam, because she said, "Oh, I can't let you go to the bathroom because I can't prove if you're cheating or not." So wrote that exam as fast as I could. Don't even remember what the exam was about because my head was in the garbage. And I then got myself to the Royal Alec Hospital and in Emerge. And it was that doctor that kind of made a little bit of made me feel seen for the first time, of like, yes, this isn't normal, but I had the RH factor in my blood type. And so he said that could potentially be what's causing it if your baby has a different blood type, which she ended up having. And so that was kind of the only doctor that really took me seriously and was like, no, like, we will get you these medications. You can't feel like this. And then I was driving home for work one day early in the morning, and I always had like a vomit bucket in my car. And I was very sick driving to work, and I ended up getting pulled over. Well, I was pulled over vomiting, and a police officer pulled up behind me, and he's like, "Oh, are you hungover? Were you drinking last night? Were you this and you're that?" And I'm no, like, I swear to God, but I was a little bit too early to have a bump. And I'm showing him my ultrasound. He's like, "No, I'm going to need you to blow in this um their thing to see if you have alcohol in your breath, your breathalyzer." I was like, "Are you for real right now?" And of course, it blew zero because I am just pregnant and extremely sick. And it's like, even those moments, like, were so embarrassing. And I was alone with the police officer incident, but nonetheless, like, just so embarrassed that that happened to me. And people just driving by me on the highway were probably like, oh, that girl's not having a good day, you know? And not because I was breaking the law. I'm just a mom out here trying to survive. But yeah, during that nursing exam, and just like, she just let me sit there and do that. And so sick. And that was the moment, like, I called my mom, like, okay, you're gonna have to tell my dad that I'm pregnant because I was too scared to. And I'm gonna need help. Like, I need assistance here. And um my now husband was working away, and so it wasn't even like he was able to hop in his car and drive. But once I was closer to home, every time I was in there, I would let him know, and he'd show up with flowers and a sugary drink or things like that. And you both spoke about your husbands being your rocks and support, and I can't even um say how important that is, to have those people in your corner, seeing what is going on behind the scenes, and not trying to take away what it's doing to you. Like, when you're hearing all these people saying, oh, it's just pregnancy, it's just this and that, and they're there to meet you where you are and be like, no, this isn't just pregnancy. And see everything you're doing while growing these babies. And I want to touch on the grief aspect a little bit. I don't know how you two feel, but when I was going through my pregnancy and that sick, I was so envious of these women talking about how pregnancy was the best time of their lives. They've never felt better. They'd be pregnant forever. I'm like, okay, but like, what part are we loving? But they didn't have this. Did you guys experience that?
Yes, I think that when I was going through it, especially the first time, and I didn't know I had hyperemesis gravidarum, I just felt really confused. I was so confused as to, how do women get in their cars every day and, drive and go to work or take care of their families or do these different things when I was in this state in bed and I couldn't get up. I couldn't move sometimes. I couldn't put my thoughts into words properly. And I was just so sick. I felt as though I was doing something wrong, like I know how strong I can be. And I was very confused as to why I couldn't kind of push past the pregnancy sickness that I was experiencing. I do think that during my first pregnancy, I had more of a moderate version of hyperemesis gravidarum. And then with my second, it was much more extreme. And so I do feel those moments that were kind of taken from the pregnancy, but especially those moments that I missed out on with my family, my son, and those times where, he was also quite young when I was pregnant with my second, my firstborn. And um, it was really hard to not be with him when I wanted to not be able to do the things that I wanted to do with him. It was really hard to kind of step back from the role that I was playing and just be there lying in bed and missing out on things. So I definitely feel like there is definitely some challenging aspects to it, as you mentioned. And with it being this spectrum condition, it can look different for different women, but there are also so many commonalities about it. And the grief, as you mentioned, could be
Mm-hmm.
one.
Yeah, I think that it's not only the grief while you experience that, but also when you decide, okay, this is enough for me. I'm not going to do it again. I always wanted to be a mom, but I never imagined that my pregnancies were going to be like that. Like, you see baby showers, beautiful photo shoots, baby registries, beautiful pictures, and all that kind of stuff. And that never happened for me because I didn't want to.
Mm.
I can't imagine um, having a party or having a photo shoot while being that sick.
Mm-hmm.
So it's very hard. And then after my second pregnancy, I was told that if I try again, my chances of survival are minimal. So I decided that is enough for us, and my husband was agree with me, because then we want to see our kids while they grow up. And I feel that I am still in that process of accepting that we are done. We are not having more kids, and not because of us, it's because of HG. We can't do this again. And I think that a lot of people don't get it. I have close friends that even don't get it. And they got pregnant and then asked me, why did you do to be that skinny after your pregnancy? I want to have that. I want to be like you. And I was like, oh my God, no
No, you
kidding. You don't
don't.
want to be. You don't. You don't want. You don't want to feel that you are dying every day.
Yeah,
Right.
truly. You are
Mhm.
so right. You mentioned too the LinkedIn page. So that is for professionals in the medical field that's there to educate them. Is that the purpose?
Yes, any
Yeah.
professional who'd like to connect for anything on the topic of Hyperemesis gravidarum, we post on there different things, webinars, resources, things that come up. And we're just looking to make some connections and put this on the radar and make sure that women know about it going into pregnancies in case they end up with Hyperemesis gravidarum. I know, there's such a lack of research on the topic. It's estimated that between 2 to 10% of pregnancies are pregnancies with Hyperemesis gravidarum. So, I mean, the numbers are small, but they're really not that small. And so
Mm-hmm.
there are women out there who are suffering and who are having their symptoms and concerns dismissed. And I really do think if we are able to share information and knowledge about things that are pregnancy related, like gestational diabetes, preeclampsia, we also need to be sharing information and educating about hyperemesis gravidarum, because there shouldn't be women out there who don't know that they have it and be suffering when they in fact have a condition that can be very dangerous for the mother and baby
Yeah.
and life threatening.
That's just it, right? And even it wasn't until I was in the Royal Alec with my most recent pregnancy that I even realized how detrimental like preeclampsia can be and things like that. And so this is right there with it. And medicine is always evolving. We're always learning. And I think it's important that anybody in a situation of caring for, prenatal patients, working in emerges, working in any clinical space that may come across this, like we always need to be learning, and we need to be even just know, okay, that this is out there, these are the symptoms, I need to look for it so I can support my patients. What is the reporting like for hyperemesis? Are the percentages so small because it's not being appropriately reported, and that it's miscommonly um, categorized as just pregnancy sickness? Or what? Do you know much about that? That's kind of where my head went. Is this misreporting, and that's why our percentages are so small?
Well, I can comment on that. I would
Yeah.
say that for maternal health in general, we don't have good registries.
Right.
So we don't know what is happening when we are pregnant.
Mhm.
And there are no official numbers about HG. The numbers that we have are, at least the majority of them, self-reported. But then if you don't know that you have it, how are you gonna self-report that you have had AHG, right? So that is one concern. And then the other aspect of it is that not only patients are not aware, but professionals are not aware either. So as you are saying, it could look like just morning sickness in a chart when it's actually hyperemesis gravidarum.
Mhm. And to put the, not pressure on the patients, but the responsibility on the patients to be the ones self-reporting. Most people don't even know how to do that. And like where would you report that? What are you looking for to report? All of these things, and again, that's where these medical professionals need to step in and take over and be like, "Okay, this is what you have." And there are women out there such as yourselves, which I can't thank you enough for the work you're doing, but are dedicating their time to you know, creating awareness and making this more known. And I want to connect you with those people so that you can be a part of this huge movement. And I really hope that in a few years we can look back and be like, wow, I can't believe we ever, allowed women to go through this and just go through it and then try and process it on their own when it's 2025. We are evolving and we need to be evolving and realizing how serious these things can be. And obviously, Maria, you've experienced an outcome of how serious this can be, right? And we absolutely need to be taking that into account. And it takes special people to step up and be the ones to create these movements and create these waves in healthcare. And I think something that we struggle with in Canada in many different aspects is the fact that our healthcare is, provincial. There's not like a nationwide thing that says, okay, this is how you report things. You must report these signs and symptoms in your patients. It's like some provinces are nailing it, other provinces haven't had anything charted in years. And it's like, how are we supposed to create change and support our, moms and our just human beings in general and, create those waves in our systems? And I know there's no cure for HG yet. And God, I pray that that's coming and that we can figure out something, even if we can take it off a little bit so that our moms can have somewhat of a quality of life while they're pregnant. Like, it is supposed to be such a magical time. And what you're doing is such an incredible thing that unfortunately not every woman gets to experience by choice or not. And so, we just have to be doing these things.
Yes, I think it's so important. And
Mm.
after going through both of my pregnancies, I realized that I was one of those that kind of fell through the cracks. I was one of those women who thought, you know what, I can lay in bed for however many months I need to, and I can just push through, and I'll push through and I'll wait it out. And now looking back and seeing what I went through and understanding everything that I went through, I realized how dangerous that was. And I think by speaking up and sharing our stories, and um, by hearing your story, Maria, and your story, Alexa, I think hopefully it will resonate with other women who may be going through this, and that they may be able to get the help and support that they need, because there is help and support that can be accessed, but it can be very challenging to be accessed. And I think having a support person going with you to appointments to help advocate for you if you're going through this is such a big and important thing, so that you have someone who can also speak on your behalf if you're not able to express how you're doing. And I think it's also so important to have someone kind of take note for you. Are you losing weight? How many times a day are you getting sick? Or have you had anything to drink today? Have you been able to keep down any food? I mean, I can't even count to the number of days that I went without eating anything. And I realize
Mhm.
now, you know, after trying to seek support and not getting it, how, frustrating that is, especially as a Canadian, because the support can be there and it can be accessed, but it can be very, very difficult to get it.
Mhm.
The support and the care.
Yes, and you have to be like, again, we put so much responsibility on our patients to be advocating, and I think as a system as a whole we are burnt out and we are only human beings. And I think so much of the time we see, in quotations, common symptoms, and it's something that maybe we brush off because we don't know enough about it. And I think even the days can run into each other, and it's hard to kind of remember what yesterday looked like versus today when you're in that state. And even having a little journal, or if you have a day planner and writing, even if it's your support person, just writing maybe what that day looked like for you. And so, even when we talk about kick counts and stuff, you have your dates, and it's like, okay, during what times and how many kick counts. So we can kind of see what things are doing. And I think it's important, they need to see that on paper. What did the last week look like? As opposed to you just sitting there and be like, well, like, I don't think I've eaten in the last few days. And I think I've thrown up this many times. And I think I've had these symptoms. It's like, no, here they are as they're occurring. And, we need to do something about this.
Yeah, I think that is a lot of responsibility of the healthcare system. But while we fix that, patients need to self advocate and
Mm-hmm.
really ask for what they need,
Yep.
because otherwise they're not gonna get the care they deserve, and that is available. Because that's the other thing, is that it's not that we don't have medications. We don't have a
Right.
cure, unfortunately, but we have medications. And if medications for some reason doesn't work, which was my case, at least we have supplementation and things to offer to those moms so they can make it um, as safe as possible.
Mm-hmm. I completely agree. We got to utilize these resources when we find them. And I can only hope too, like, as the professionals, if they do see this coming through their office and through their with their patients and things like that, that they, we can start to put together maybe a common theme that we're seeing. And okay, I've had a few patients that have had this, doesn't really classify as normal. And I know in the medical world, our normal is a very wide range generally. And so once if you're in that range, you're considered normal. But yeah, we have to do better. But I'm so excited that you girls are doing this. And I know you touched on what the HG Canada page is and things like that, but what exactly do you offer to support moms that are maybe finding themselves in a position that they may be considering that this isn't just pregnancy sickness?
Yeah, so basically, it's simply Maria and I trying to spread awareness and advocacy and education about Hyperemesis gravidarum, and connect moms who are going through it with our Facebook page, the Hyperemesis Gravidarum Canada community chat. Women or families who are going through it can chat, ask questions to each other. It's a very supportive group of people who are going through the same thing or who have gone through the same thing. We're trying our best to really spread awareness and knowledge, and it's just Maria and I behind the scenes.
Yeah, I think that the other thing that we offered with our limited resources is connected them with things that already exist,
Hmm.
right? So we have had moms from different provinces asking for maybe um, names of medications. So we then send them to the Her Foundation website where they can
Yes.
see the available treatments. Moms asking for specific doctors that are aware of HG, and then we try to connect them with those type of doctors. Even finding home care options locally when we can, so they can at least self-advocate and ask for something specific. So that is what we are doing on a volunteer basis.
I love all of that. And I'm absolutely going to have all of those links that we mentioned throughout. I know there's quite a few, which is fantastic. And they will all be linked so you don't have to rewind and pause and play this and try and write everything down. Quick fixes. I appreciate your guys' time so incredibly much. I know you're both busy moms and it's Sunday. So that is, thank you for taking time out of your weekend to meet with me as well. I don't want to take up too much time, but is there anything else that if you didn't talk about, you wouldn't be able to sleep tonight.
Well, I will say to all the moms out there that are going through HG, that you are not alone. You are truly not alone. You are not the only one. We are very unique, and we got HG, but you got it. Even if you think that you don't, just speak out, get the treatment that you need, um, connect with the resources and the right people who can provide what you deserve, and then try a one day at a time approach, because sometimes it's so difficult when you are just in day one in the first trimester and you just imagine that you are missing more than the half of your pregnancy. Even thinking on being able to cope for a day is hard. So just focus on the moment, focus on dealing with one moment at a time, and the relief will come. You will need some help during the postpartum as well, just to recover not only physically but mentally. But
Yes.
at the end of the day, you are not alone and you have a community to support you.
Yeah. And I think it's important to put that importance on taking care of yourself as women and as moms. We are always the last people to be taken care of, especially by ourselves, right? And when you're in that postpartum period, we're so focused on these new babies and things like that. And I think some of the healing might be able to get pushed to the back burner easier than not. And so, and two, like, I don't even think I'm really comprehending the amount of mental health stress that put on me until we're having this conversation today. And that was 5 years ago. It's like, yeah, no wonder I was a hot mess express. And many other reasons, being postpartum. But that was amazing advice. Julia, do you have any other advice for
Yes.
our HG
Say,
mamas?
yes, if you think you might have hyperemesis gravidarum, look into it further. Access the Her Foundation website. Check out the comparison between morning sickness and hyperemesis gravidarum. Start asking questions. Push further if you get dismissed. Bring those support people in with you when you go for appointments, and just try to get by. If you're going through it right now, as Maria said, it might not be day by day, it might be minute by minute. And
Mm-hmm.
I hear many HG survivors say that some of the days, or many of the days, or all of the days, they were surviving, and they were surviving minute by minute, just trying
Yep.
to get by, just trying to take deep breaths in between, because that relentless nausea that never goes away, day and night, day after day, is very, very difficult. And if you can, reach out to the support networks that you have. And if you're in Canada, join our Facebook group, check out our
Yes.
Instagram, and connect with us. If you're a professional who'd like to connect and chat with us, please reach out. Um, I think women who have gone through hyperemesis gravidarum show so much resilience, and in
Yep.
both of your stories, you can hear it. And I think with other women who I've connected with who have gone through it, you hear these amazing stories of resilience, and um, wonderful things that have come out after their pregnancies, where it's given them resilience and strength. And um, I just think that, especially for those moms who experience losses during the pregnancies, it can be so difficult and challenging. And thank you, Maria, so much, and Alexa, for sharing your stories. They're touching, and I think both of you are so strong and resilient and amazing for sharing your stories, um, and sharing with other women. It's just inspiring. So thank you. And I guess my biggest piece of advice is reach out for the supports if you think you
Mhm.
have hyperemesis gravidarum or know someone who does. And maybe by connecting with some other resources, you might feel a little bit less alone as well. There is SICK, The Battle Against HG, the short film. by Charlotte Howden, which is one to watch if you're looking to see some experiences of other women who have gone through it. And her foundation has stories of other women who have gone through it, and some people to watch if you're looking into hyperemesis and wanting to know more, because there is so little research and information on it still at this point. Someone to follow definitely is Dr. Marlena Fejo from, she's based in the US, and she has done amazing research about Hyperemesis gravidarum, and there have been recent discoveries that it's linked to our genes. So they're very interesting stuff coming out, and some of it is all very new and really interesting to find out about. So there's Dr. Marlena Fejo, also Dr. Stephen O'Rahilly from the University of Cambridge, if you're looking to do a little bit of research on your own.
I appreciate that. Yeah. And I wouldn't mind if you would be able to send me their social handles as well, so I can attach them here and do a little bit of research myself. And I just want to mirror back to you, Julia, about sharing your story and your resilience and everything, definition of strength, 100%. And then not only to go through this, but then dedicate a lot of your time to helping other women. Again, I said it takes a special person to do that. And I think as women as a whole, we are resilient, we are strong, and that is why we do the babies and the men do not. However, they do deserve credit where credit is due. So to all the men who support their women, and, the husbands, or, if just your partner, if you have a partner who is pregnant, and the helplessness I'm sure that you feel, the biggest thing you can do is just be there to support your partner, advocate in appointments, help create those, journals of what's going on, and just be there for your person. That is all you can do. Unfortunately, it's a very helpless situation, like I said, but we all deserve some credit, and yeah, just keep doing what we're doing. And I think we're doing an awesome job. But again, I just thank you girls so much for your time here today. And social media is such a powerful tool, and I'm so glad it connected us, and that we are using it for our benefit of connecting moms, creating awareness, spreading knowledge, and, everyone who's out there doing all of this research and things like that, keep doing the things. Thanks for listening to this week's episode. Please take a moment, and on whatever app you're listening to us on, press that follow button to stay up to date with all future episodes. If you or someone you know are interested in being a guest on the Beyond the Birth Story podcast or a sponsor, please visit our Instagram or Facebook at Beyond the Birth Story podcast and send a message or fill out that contact form. I would love to connect with you. As always, remember to be gentle, kind, and hold space for yourself when you need it.